Hello, ladies and gentlemen. Here we have live data coming from our patient, but I would like to start with a story. On Friday, I was listening to the President of Estonia giving a speech on proactive medicine. I was so inspired by this, I went to a shop and bought a smartwatch. 2 hours later, we were here and assembled a great team. A team of developers, healthcare professionals and entrepreneurs.
And we are here to solve real problems. I am a medical doctor, and I would like to ask from you, how many of you have ever worried about your relatives or your parents, grandparents' health? Raise your hands. Quite many. And I agree, we should worry. Because right now, home treatment and follow-up for these chronically ill patients is crap. People fail to take their medication, they fail to comply with treatment given by their doctor, and they end up in the hospital. This costs millions and billions every year, and we need a new solution for this.
The solution is Heartify. Heartify uses readily available consumer devices, such as smartwatches, to monitor your health vitals. It transmits your real-time heart rate, your weight and blood pressure to the system, where your personal doctor can make a personal treatment plan and help you take your medicine on time and in real amounts. For the first time, doctors can monitor their patients' heart and vitals in real time to see if their health deteriorates.
This is especially important in chronic heart failure. It's a disease that affects 10 million Europeans every year. It is the single leading cause for hospitalization in people over 65 years of age. And when people end up in the hospital, the saddest part is, it is because they fail to comply with treatment, fail to take their medication or follow instructions. And when they end up there, it costs money. For example, in Finland, one visit is 5,000 euros per patient.
Heartify will help prevent rehospitalization. It will help save time and resources, including money. Heartify is a service from doctors to doctors. It's targeted against healthcare service providers. The revenue will come from health insurance companies and hardware manufacturers. Heartify holds the future for helping patients with chronic lung disease and diabetes. We already have support from 3 medical doctors and 1 hospital in Tallinn. Heartify is a small step in science, but a giant leap towards proactive medicine.
Sorry, I have to go. I just received a message that I have a patient who broke his treatment plan. He's running in a conference.
Okay, thank you.
Question?
In one sentence, how much you managed to build over this weekend? So what is ready and what's to be done in the future?
We have a real medical problem. We know that building your own hardware in this context is pretty pointless since we have readily available hardware for that. We managed to get a connection from real hardware to the live server. We have a business case. We have had talks with several medical professionals and a hospital, and we have a real problem which needs us.
Thank you. Any more questions?
Very good idea. There have been some examples of to trying this in real life here in Estonia. How much is dependent on the smartwatch that you built, and how much kind of IP do you have on the server side? So which side is kind of more important for you?
Both sides are important, but our solution would be hardware agnostic. We won't rely on one smartwatch per se. We would have different hardware to be working with our system. And the whole idea is a solution which incorporates hardware, software, backend, cloud servers and doctors.
Okay, thank you very much for that.